during the surgery for spina bifida, we actually do a couple of things that we wouldn't do in perhaps some other surgeries. First of all, we try to very clearly identify the lower back of the fetus, and if necessary, based on our observations at the time of the operating room procedure, they can move the baby slightly so the back side, the side that they're interested in operating on, is actually pointing up. So when they make the cut in the uterus, they have the part exposed that they're interested in. Then in addition to that, while they're doing the procedure and before they're doing the procedure, we provide some important services. Probably most importantly is we map out the placenta very nicely for them after they've already made the cut in the abdomen, but not yet in the uterus, and that is right on top of the uterus. We tell them exactly where the edge of the placenta is to avert any injury to the placenta at the time they make the incision into the uterus. So this is what we call placental mapping. During the surgery, we keep a very close eye on not only the cardiac activity of the fetus, the heart rate of the fetus, the umbilical cord, but also the contractility of the fetal heart. And we're just keeping an eye on what's happening to the fetus and whether the fluid has gotten dangerously low, because as you know, they can keep an infusion of fluid just to kind of protect the umbilical cord during surgery. So we keep an eye on all of that while the neurosurgeons and the fetal surgeons are working on the baby.